me chamo Ana Júlia.
Eu me chamo Kamylle.
Eu me chamo Bianca.
E nós somos alunas do segundo período de radiologia e vamos falar sobre acidente vascular cerebral, mais conhecido como AVC.
This is the third part talking about stroke cerebrovascular accident. And in this video, we will cover rehabilitation, prevention, and stroke in the post-COVID period. Rehabilitation after a stroke is essential for the patient to recover lost functions and improve their quality of life. It is a continuous and individualized process that requires commitment from both the patient and the team of professionals involved. This multidisciplinary team includes physiotherapists, occupational therapists, speech therapists, neuropsychologists, and other specialists who work together to offer comprehensive and personalized treatment. Physiotherapy contributes to the recovery of muscle strength, balance, coordination, and gait. Techniques such as hydrotherapy and specific exercises help prevent complications such as contractures and muscle atrophy. Occupational therapy focuses on resuming daily activities such as dressing, cooking, and performing household tasks. The therapist uses adaptations and techniques that promote greater independence for the patient. Speech therapy, essential for the rehabilitation of speech, swallowing, and communication. Through targeted exercises, it helps with articulation and language production. Neuropsychology evaluates and treats cognitive and emotional changes, such as difficulties with memory, attention, and mood. Specific techniques stimulate brain functions and help the patient deal with emotional changes. Other approaches, such as hydrotherapy, mirror therapy, and virtual reality, can also complement the treatment. For example, hydrotherapy reduces the impact on the joints, facilitating movements. Mirror therapy stimulates brain plasticity by creating the illusion of movement in the paralyzed limb. These combined strategies contribute to the advancement of the patient's recovery and autonomy. Stroke can cause serious disabilities or even lead to death, but a large number of cases can be avoided through lifestyle changes and control of risk factors. Among the preventive measures to be taken, we can mention prioritize foods such as fruits, vegetables, whole grains, lean meats, and fish. Avoiding ultra-processed products rich in fat and sodium. Practice at least 30 minutes of moderate exercise on most days of the week. Maintain a healthy weight through a balanced diet and exercise. Regularly check blood pressure and follow medical advice. Monitor glucose and cholesterol levels, adjusting diet and treatment as needed. Quitting smoking drastically reduces the risk of stroke. Limit or avoid the consumption of alcoholic beverages. Have frequent checkups for early detection of possible health problems. By adopting these habits, it is possible to prevent many cases of stroke and ensure a healthier and more balanced life. During the COVID-19 pandemic, a significant increase in the incidence of stroke was observed, especially among patients who faced severe forms of the disease. COVID-19 can cause changes in blood clotting, which favors the formation of clots and increases the risk of stroke, particularly ischemic stroke. Patients hospitalized with severe COVID-19 are more vulnerable to these events, which demonstrates the relationship between the infection and the cerebrovascular impact. In addition, patients who had already suffered a stroke before infection with the coronavirus are more susceptible to new strokes after the illness, even after recovering from COVID-19. Many people experience long-term neurological sequelae, such as cognitive difficulties, fatigue, and motor problems, which can simulate or worsen sequelae of a stroke. This reinforces the importance of continuous monitoring and medical follow-up, especially for those with a history of stroke. Therefore, it is essential that patients who have had COVID-19, especially those with a history of stroke, maintain regular medical follow-up, controlling risk factors such as hypertension and diabetes. In addition to rehabilitation therapies for possible sequelae, can help in recovery and prevention of additional complications. Awareness of the risks is fundamental to improving brain health and reducing the impact of a possible new stroke. Stroke continues to be one of the main causes of death and disability in the world, demanding attention in prevention, treatment, and rehabilitation. Despite medical and technological advances, complications and sequelae represent significant challenges, impacting the quality of life of patients and their families. The statistical overview highlights the importance of public policies aimed at awareness and early diagnosis, which are crucial to reduce the incidence and severity of cases. In addition, the impact of the COVID-19 pandemic has highlighted the need for continuous studies on the relationship between viral infections and the increased risk of cardiovascular and cerebrovascular events. Therefore, the relevance of preventive campaigns, the expansion of access to specialized treatments, and comprehensive support in the rehabilitation process are reinforced to minimize the impacts of stroke on society. Only with joint efforts between health professionals, governments, and the population will it be possible to reduce the burden of this disease and improve the quality of life of patients. Thank you very much for watching the video until the end. We hope you enjoyed it and learned more about stroke.